be under unimproved sanitation, as shown on this figure. But we would like to see on the next slide, because we have under unimproved no facilities, bush or field. So you can see that open defecation still really exists. Councillor, sir. I now use the preceding explanations to discuss my research efforts and contributions to knowledge. Most of my research efforts have been on unraveling the level and different dimensions of relationships between neighborhood environmental factors and health status of residents, particularly in the slum areas of Lagos and other Nigeria's cities. These efforts are discussed under 6 major research areas or issues as highlighted in this figure. And the next are some of the major communities, low-income communities that I have worked on. I'd like you to watch a short video. I'll skip it because of time. Socioeconomic factors influencing health outcomes of urban settings. Different investigations carried out by Nwokoro and others as listed on the socioeconomic profile of the slum dwellers as well as other urban residents in different cities all justify their relationship to their health status. We can see on this figure that majority of the slum dwellers earn below 80,000 naira per month, which is actually the minimum wage in Nigeria. And again, most of them have just secondary school as their highest level of education. The study by Nwokoro and Olayinka, and also the study by Lukman, Nwokoro, and others, all have concluded that there is an interplay between urbanization, population growth, poverty, and health. This is where I have made the most significant contributions to knowledge. The environmental issues mostly investigated in my researches include access to improved water sources and sanitation methods, as well as waste disposal methods, drainage conditions, and indoor air pollution, which are factors peculiar to the Nigerian environment. In terms of access to water in Nigeria, it is important to note that access to piped water to homes in major cities of Nigeria has reduced drastically to only 6%. But access to other improved sources of water is on an average of 78% in urban areas and 50% in the slums. These are some of the challenges people face in getting water. And you can see in this figure that you have mostly children and women who always bear the brunt of this problem. This is water in the midst of death in slum neighborhoods of Lagos. This is Makoko. Again, access to sanitation in Nigeria has decreased from 36% in 1990 to 31% in 2012. Open defecation rates at 28.5% pose grave public health risks. There have been studies linking neighborhood environmental factors and health outcomes in urban settings. These inextricable links between these neighborhood environment factors and health were all ascertained by various studies done in different urban areas, especially in Lagos, and as listed in Nwokoro 2007 specifically, the disease pattern and their relationship to environmental risk variables were investigated in low-income communities of Bariga, Agege, and Ajegun in Lagos. The correlation matrix showed a high correlation between the most prevalent reported diseases, such as malaria, followed by diarrhea, with poor environmental conditions across all these communities. In spite of some of these efforts made towards addressing these inequalities in service delivery, the burden of diseases associated with poor sanitation, poor access to potable water, and other environmental health conditions seem to be on the increase, as shown on this 5. You can see that's human waste disposal, which is a major sanitation problem in Lagos. Healthcare services systems and burden of diseases of urban residents. There have also been studies on the healthcare services and systems in Nigeria, which all show a country that suffers shortage and in great need for improvement. These deficits in the healthcare services and systems, as well as social and environmental determinants of health discussed earlier, manifest in the burden of diseases experienced by urban residents as corroborated by the health indicators. Studies on access to healthcare facilities and services, especially in slum areas of Lagos, include the studies that have been noted, which all corroborate a deficit and an urgent need for action. There have been some spatial distribution studies. The first was by Nwokoro, foray, and Agulo in 2011, which investigated the relationship between transportation and the location of existing healthcare facilities, and also analyzed the spatial distributions of these facilities using locational quotient statistical measure, as shown in the next slide. This actually shows the spatial distribution of some of the facilities, healthcare facilities, across local government areas in Lagos Central Victoria District. And the next slide also shows that none of the communities noted here could make the expected healthcare facilities. Only one, Akibaye, which had 6, and it was expected to be 6. So there is truly a deficit in healthcare facilities. Environmental health and burden of diseases in women and under 5 children. Mr. Vice Chancellor, sir, I would like to start this section with this quote by Michelle Obama, former First Lady of the United States. And I quote, "Communities and countries and ultimately the world are only as strong as the health of their women." Nigeria is reported to have 13% of global maternal deaths, although there has been a reduction of maternal deaths over the years, from 1,200 in 1990 to 540 in 2013. This improvement was not enough to have met the MDG target of reduction, and that is why it found itself back in the SDGs. Nigeria ranks 24th amongst other WHO African countries, and still falls far below the global figure of 210 deaths in 2012. Studies by Nwokoro and Abona examined the environment and health inequalities of women in different neighborhoods of metropolitan Lagos, Nigeria, and reported that indeed, women across all income levels experience some diseases associated with poor environmental conditions, but the issue of stress affecting their health status was thrown up in the focus group discussions. The next study now took it up from there and x-rayed the relationship between stress, environmental factors, and the health of women, and concluded that environmental stressors and severity of chronic illness are linked to stress. The last study under this group was by Nwokoro and Tani, and we examined the environmental health conditions of under 5 children in slum settlements of Lagos. The findings actually agree with the national figures, although in higher intensities, because malaria was also found to be the most prevalent disease in these children, followed by diarrhea and cough and catarrh. This is an intra-urban environmental health study which looked at different income neighborhoods in Lagos, and as expected, diseases were most prevalent in the low-income area of Bariga. Another study by Nwokoro and Ilechukwu assessed the housing and environmental health conditions in 3 blighted communities of Lagos, Makoko, Ajegule, and Mushi, and actually concluded again that most prevalent diseases related to poor environmental conditions, as well as the level of patronage of health facilities, were all embedded in these communities. And the next slide also shows an intra-urban health finding showing almost similar results. In 2013, my colleagues and I got a research grant from the University of Lagos Central Research Committee and carried out an interregional study entitled Investigating Environmental Health Conditions of Quarter Settlements in Nigerian Cities, Comparative Study of Lagos Metropolis and Port Harcourt. This was focus group discussions. We actually visited the slum areas in Port Harcourt. You can see the waterside area of one of those communities. And some of the results include that the slum residents in Port Harcourt have higher access to basic primary health centers than those in Lagos, whereas the slum residents in Lagos have higher access to health insurance as depicted in the following figures, with Lagos in blue and Port Harcourt in yellow. In terms of patronage of health facilities, slum residents in Lagos in blue patronize the hospitals most, while those in Port Harcourt patronize patent medicine stores, as shown in this figure. I am glad to announce that the gains of these research efforts and the need for further research and mentorship role for some students who have shown interest in this research area led to the development of two multidisciplinary research groups as listed, aptly profiled at the Research and Innovation Unit at the University of Lagos. My foremost international collaboration was on my PhD research work entitled Neighborhood Environmental Factors Affecting the Health of Women in Metropolitan Lagos. This earned me a sponsorship by the University of Lagos to travel to Lancaster University, United Kingdom in 2006. I was domiciled in the Department of Geography and collaborated with Drs. Lenny Bear and Elizabeth Oxon, especially on the use and analysis of focus group discussions. At the end of my 3-month stay, I came back with an outstanding letter addressed to the then Vice Chancellor, Professor Oye Ibidafobe, by Professor Barbara Meha, and I quote part of her comments. Immaculata has been an excellent ambassador for the University of Lagos. It was a delight to have her in our department. We hope that there can be further links between our two universities building on this link established by Immaculata's visit. I am able to disseminate my research findings, particularly on the need for improvement in the access to water and sanitation facilities, as well as other neighborhood and housing conditions at different international fora, particularly at the International Conference on Urban Health, ICUH, held in Canada, Kenya, USA, Brazil, Italy, UK, and other urban or environmental health-related conferences in other countries. I'm indebted to ICUH for awarding me full scholarships to attend all these conferences except one. These are some of the pictures. I don't take so many pictures, but I picked some of these. These modest efforts earned me invitations as the urban health expert, sometimes one of very few researchers representing Nigeria, to global urban health meetings with solutions to challenges of urban health on the front burner. Thus, I was invited to the Health and Wellbeing Urban Thinkers Campus that was held in 2016 in Malaysia, the Urban Governance for Health Workshop hosted by APHRC Nairobi, Kenya, and United Nations University IIGH in Nairobi in 2015. I was a guest speaker at the City Forum, a planning and urban issue speaker series by the Community and Regional Planning Program at the University of Texas at Austin. These efforts gave me the much needed exposure for networking and exchange of ideas with other urban health experts, as well as increase in knowledge in my research area, which in turn have benefited my students and other mentees. I have also been able to affect policies in environmental health issues. Mr. Vice Chancellor, sir, it is now time to discuss some of my other contributions to the urban and regional planning profession, to the university and community as a whole, training and mentorship of urban planning students at all levels, I was employed in December 1998 as an assistant lecturer, the 5th and first female staff of the young department, and respected with heavy workload. Indeed, I remember I was the first advisor that graduated the first set of students in 2002. And again, in 2009, I was also the postgraduate coordinator that equally graduated the first set of MSc students in the department. To the glory of God, one of my supervisees, Dr. Layinka Aguloye, graduated as the first PhD from the department and the record, and now my colleague. I've supervised other students at various levels, 6 PhD students at various levels of their program, 20 MSc and 52 BSc students. Most of my mentees are gainfully employed in various areas. I've also been involved in a few professional activities as listed. I have been appointed to some key administrative positions and committees in the university, and it appears that my dedication and modest contribution to each of these committees led to another, until the two most recent appointments as Deputy Director, Quality Assurance and Servicom Unit, and Director, Center for General Studies. As DD Quality Assurance, aptly nicknamed University Police, in reference to my yellow fever colorful vest, provided by the current Director, Professor Chukwu, which I wore during monitoring of examinations as students and lecturers attenders at classes, the efficiency of toilets and services, and even administrative staff. I want to state that such impromptu visits were paid to the offices of the University Bursar and the Registrar, and commendably they were on seat. I was still contemplating, or maybe still trying to muster enough courage to pay a similar visit to the Vice Chancellor's office before my tenure expired in February 2017. Recently, I started my tenure as Director, General Studies, and I'm still working out a template that will add value to what my predecessors had already put in place, and asking God for abundant grace. I also made a few contributions as acting head of department between 2011 and 2013. I was focused on giving the department a facelift in terms of infrastructural development in both departmental and staff offices, bearing in mind my passion for a healthy and conducive environment. Staff welfare was also prioritized. We also organized, the department organized a very successful and well-attended second international conference in 2012. And there were also a few publications, volumes 1 and 2 of the third Urban and Regional Planning Review in 2012, and another book entitled Emerging Issues in Urban and Regional Planning, published in 2013. Other contributions have already been listed by the Vice Chancellor. I have done a few consultancies, but worthy of note is being a member of Pilot Projects Advisory Group, Building Nigeria's Response to Climate Change. This body partnered with the Federal Ministry of Environment, Abuja, to create awareness on climate change and develop policies and publications, as well as develop some mitigation strategies for selected vulnerable areas. Most of my contributions to the university, to the community, are to the University of Lagos Women's Society, where I have served dedicatedly as General Secretary, Treasurer, ex-officio, and board member under the leadership of various presidents of the society, Mrs. Shola Ibidabobe, Chief Mrs. Titi Odubemi, and Alaja Muda Bello. Perhaps the most outstanding contribution to this society is the UAWS 502-bed space female hostel, a build, operate, and transfer project with the University of Lagos, which I have been coordinating from conception to the commissioning that is due at the end of this month. With two other passionate members of the society, one seated here as the registrar, and Mrs. Hope Nwokoro. I'm a strong Catholic, and so I've also contributed to that community. I have also been an advisor to the Nigerian Federation of Catholic Students, University of Lagos Catholic Chaplaincy. These are some pictures showing my efforts at the UNWS 502-bed hostel. This is the strong building team made up of the contractors, the consultants, and the building committee. You can see Mrs. Bello smiling in front of them. This is where we are today, and this is where we hope to get to. We are commissioning two of the wings of this project come October 31st. I congratulate the UNWS, Mrs. Bello, who is still the president, and all other members of UNWS for this great feat. Recommendations and conclusions. My researches in the field of environmental health have been able to establish that there is a strong link between the poor environmental conditions of the slum areas and their health status. Based on the focus of my researches and solving the associated problems, the following are my recommendations. I actually made 10 recommendations, 6 for the poor and vulnerable groups in the slum, 4 for the university community. However, my key recommendation is a synergy between public health and urban and regional planning, where health professionals engage in the urban planning arena, involved from the design stage, participating in zoning decisions, and serving on urban planning boards and incorporating health into urban planning decision making. Other recommendations, general recommendations as listed. For the University of Lagos, I have also made some recommendations, but I also want to state that there is an urgent need for a modeling studio and workshop for our students in the department. There is also a need for an urban and regional planner, a registered urban and regional planner in the works and physical planning unit for the effective translation and implementation of the university master plan into orderly, beautiful, functional, healthy, and conducive academic community environment. My last recommendation, which I think should interest all of us, is improving the health status of staff. I live on the 7th floor of one of the high-rise buildings on campus. Each day I wake up and overlook the unsightly conditions of the neighboring Iwaya community through my window. I had always wondered why the university had not come up with a plan that creates a more healthy landscape. Coincidentally, this community has just been demolished. And this is an opportunity for the University of Lagos to develop this area and reclaim its name as the University of First Choice and the nation's pride. And these are some of the things I see every morning. This look obviously does not impress anybody. I want to key into this by suggesting an Iwaya scheme that consists of multi-story staff apartment units, on well-prepared and holistic layout plans for this and some of the other designated uses of the university master plan. This will actually reduce the staff accommodation shortage on campus and improve the health and well-being status of the majority of the lower cadre staff who commute very long distances to work daily. And this is how the new high-rise, Iwaya high-rise. I actually would like to live there. Very distinguished ladies and gentlemen, it is time to give honor to whom it is due. From a relatively unknown village of Akwa community in Oguta local government area of Imo State, crisscrossing the eastern part through the Niger Delta region to the western region of Nigeria in search of knowledge, and now becoming a full-tenured professor in the prestigious University of